When you come to Leh Ladakh, you find you are having a lot of problems with your nose. Sometimes you're having a lot of nasal crusting and you feel like digging your nose, and sometimes it even leads to bleeding. The bleeding can be minimal when you blow your nose or you dig your nose, or it could be a little heavy also. So if the bleeding is significant, of course you have to see a ENT specialist. But otherwise, we'll just discuss the causes and the precautions that you can take to prevent nasal issues here. The first problem is that over here there's a lot of dryness in the environment. There's minimal humidity of only 25 to 50%. The air is really dry, and when the wind blows, it carries the sand along, and that also leads to a lot of crusting in the nose. On the top of that, the winds are sometimes so cold that they increase the dryness in the nose and the throat. All this leads to a lot of irritation, and sometimes you want to dig, sometimes when you blow you find blood. So all these trouble you. What do we do to prevent this? Number one, we keep ourselves well hydrated. That is the only way to counter a dry, sandy desert. So you take 4+ liters of water. It may sound a lot, but actually over here, you feel like drinking water the whole day. You keep feeling thirsty because of the dryness. So it's very easy to cover up that 4+. You don't have to really bother about that. Do take warm water. It helps in many other ways too. Number two, you can apply petroleum jelly or glycerine inside the nose. Third is, you can use some saline drops to keep some hydration in the nasal mucosa, because the nasal mucosa gets sometimes even desiccated by the cold winds, and the mucociliary action, that means they are small thin hair-like strands in our nose. They are known as the cilia. Their work is to clear the nose of the mucus and of any dirt. But over here, since their function is disturbed because of the dryness, you find that the clearance is low, and so you suffer more. The only way to help the cilia is by keeping good hydration. So put those nasal drops. You can also take steam twice a day or even more sometimes for a short while, because when the steam goes in, it hydrates and moisturizes the mucosa. Of course, if you have some severe bleeding or long-term, a lot of congestion and some persistent cough, then you need to see an ENT specialist. Otherwise, these measures help a lot to overcome this problem. Also, you can put a nice scarf, which is a little thick, or a mask on covering your nose and the face, so that they protect you from this constant dryness. So I have also added a video of the apple trees. So when we do this medical learning of our care of the health, we also see something which is special to this area. So enjoy your stay here and take care by following these small measures.